Hi, my name is Roland Ramdass. I'm a foot and ankle specialist. I practice in Virginia in the DMV area. Common goal most patients come in is, I want to keep walking. I want to keep being active, whether it's to provide for their family or whether it's to be living an active lifestyle. Our goal is to keep our patients pain-free, active, and walking. So adult-acquired flat-foot deformity is a very common pathology that we see. We see it in various stages. We see it from the acute stage of a young, healthy patient having a congenital deformity. We see it in the intermediate stage, someone who has overused their foot and they're starting to become symptomatic. Or we see it as a referral from some specialists who have been treating it for a while, and we're fortunate in our practice, we have doctors referring us, these patients they've exhausted conservative care, and now they're coming for the surgical options or the surgical management, where we are now designing a treatment algorithm to help best get them back to their functional capacity. What does conservative care entail? Well, initially you'd want to rest it, ice it, elevate it, immobilize it, anti-inflammatories. But if these things don't improve, you may then want to consider surgical options. And that's what we see most often, is the surgical patients coming into our practice needing surgical management to get them back on their feet. And when you think of flat-foot deformity, you have to think of it as a complex deformity with soft tissue imbalance and osseous imbalance. What is the planal dominance? What's the severity? Is it rigid or fixed? And what's the soft tissue like, so we can rebalance not only the soft tissues but the osseous pathology and address all. So when it comes to joint sparing procedures, you can do a combination of a calcaneal slide osteotomy, where you're cutting the heel bone and shifting that posterior tuber medially to realign the mechanical axis of the bone and the weight-bearing surface. You can do a calcaneal opening wedge osteotomy, often it's called an Evans osteotomy, where you open up the calcaneus and put a wedge in there. Often companies have the pre-made wedges, which are great. You can do an opening wedge cuneiform osteotomy, where you're cutting the cuneiform bone and opening that wedge up and inserting a graft in there. By doing this, you're realigning the medial column, you're realigning the lateral column to straighten the foot, to bring that center of gravity of the foot straight under the leg bone. So these are a combination. So you would do it either the rear foot or the midfoot and or together, oftentimes along with some soft tissue augmentation procedures. If the patient has arthritis and these joints cannot be salvaged, we do joint fusion procedures. We do it whether in situ or we do it with realignment wedges. For example, we take a wedge out here, but we do a tail and navicular joint fusion. We could do a double fusion where we fuse the tail and navicular joint and the navicular cuneiform joint together. And there are lots of products out there that we can use that are procedure specific for this medial column. Or you can do a calcaneal cuboid joint fusion also. Oftentimes when we address this pathology, we are doing what we call either a medial double or a double fusion or a triple fusion, triple arthrodesis, where we're fusing all three joints, the talar navicular joint, the calcaneal cuboid joint, and the subtalar joint, all in an effort to stabilize, straighten, and allow that foot to function under the leg. When you're treating this complex deformity, I think it's critical to have a knowledgeable rep and a company that has a robust, comprehensive set of products that can help you address these different procedures and pathology. Partnering with having Acumed and their products, I think it's important because I can be best prepared for plan A, plan B, or plan C. When it comes to the procedure-specific products, I think having the medial column plate, having the opening wedge plate, these locking plates, these screws that are dual lead screws, headless screws, these are all advantages that you can have in your surgical armamentarium to enable you to address these pathologies and these procedures efficiently, effectively in the operating room, get some accurate fixation with these patients. When it comes to different procedures, I like to do a pre-op huddle. We talk about a doctor's wish list. So if I'm going to do a talar navicular joint fusion, I'm looking at making sure I have a fully threaded cannulated screw, 4-0 fully threaded cannulated screw. I'll have a locking plate, whether it's a 4-hole plate or the medial column plate. I want to have staples as my backup. I want to have my peanut plates as my tertiary form of fixation if I need to. Screws and plates are important, depending on the procedure. If I'm doing a triple arthrodesis, I want my extremity set to be with me. I want to have my staples as my backup. I want to have some biologics available because most of my patients, they have multiple comorbidities and we would need to augment that fusion site with some type of biologic. With regards to the soft tissue, you want to make sure you have anchors and so on. So for plan A, you're going to tell your rep to ensure they have their extremity set, the different types of screws, and you're going to have your secondary and tertiary forms of fixation as a backup on the back table should you need it. As a good surgeon, you have to be prepared for plan A, B, and C because often things do not go smoothly as you want in the operating room, and you must have these products. And having a team approach with Acumed, having all of these robust, comprehensive sets, I think it's critical to have them bring them and have it available so that in case you need it, you may not need all, you have it there. I tell the residents all the time, surgery is like a dance. You know, you're dancing, you must be choreographed or in cohesion or in sync with each other. Sometimes you're fast, sometimes you're slow. So having a rep being 2-3 steps ahead of you because they've done it so often with you.